watching Let's Chat.
Coming up later into the month of August, it is the annual Minority Health Fair, and you need to make sure that you and your family get involved in this. It could help save your life. Dr. Damian Brown is joining us here on the far side of the sofa. Dr. Brown, good to see you.
Good morning.
And Chris Ramsey, you have been with the Minority Health Fair for how long?
For 18 years. We started this event in 2002, and it was done by some grassroots individuals with local fraternities and sororities. So we're glad that we're able to continue to provide this free health event to the entire community.
How did you guys come up with and conceptualize and then execute the very first one of these? Could not have been an easy undertaking.
So the men of Kappa Alpha Psi fraternity and Omega Psi Phi fraternity, both of our national organizations had an initiative around prostate cancer for men. So we decided as two fraternities, African American men, that we'll come together to make a bigger impact collectively in our community.
Right.
In year 3, the women of Delta Sigma Theta sorority came on under the leadership of Dr. Willie Mae Hubbard, who is a local pediatrician, and we expanded our services to provide services for kids and also for women. So last year we had over 5,000 people in attendance. We'll have over 125 vendors at this year's event. So it has just grown exponentially throughout the years.
Dr. Brown, next question for you. What is your role in this Minority Health Fair? You've been involved with it 7 or 8 years, correct?
Correct, yeah. So my role, along with another podiatrist, we do foot screenings. So what happens, people come up to our booth, we sit down, we talk to them one-on-one, we do exams, kind of educate them on what their problem may be.
Right. And if you are not in good podiatry health, so to speak, that can cause a lot of other health problems. It's kind of like a domino effect, isn't it?
It is. So in the field of podiatry, we tend to see a lot of diabetic patients.
Right.
And of course, with those diabetic patients, they tend to have problems with the nervous system. So one of their main complaints are numbness and tingling in their feet.
Right.
Then next thing you know, we tend to see a lot of patients with open sores,
Right.
or ulcers is what we would call them, on their feet.
And again, this is something that by having one part of the body checked out, you can help alleviate future health problems in other part of the body. Tell me what kind of health screenings that are going to be going on for the upcoming health fair.
We will have, like I said earlier, we'll have over 125, but we have lab tests that will be done by CHI Memorial. We have the Memorial Mammography mobiles will be on site. So if ladies or men need a mammogram or lung screening, Kidney Foundation will be doing kidney tests, which you will actually get to talk to a doctor before you leave. We have a number of vendors that will be doing blood pressure checks. We have the UTC School of Nursing that will be doing BMI and balance testing, especially for seniors. So again, over 125. Also, I want to let your listeners know if they have unused or expired medications, the Hamilton County Drug Take-Back Force will be there to do drop-offs. So don't flush those down your commode. Don't throw them in the trash can. Bring them to the Minority Health Fair, and the Hamilton County Drug Coalition would actually properly dispose of those medications.
Dr. Brown, 8 years ago when you got involved and you had someone like Chris come up to you, and you got a busy practice as it is, and they explained what was going on, what made you say, yeah, I'm going to take part in that? And the second part of that is, why do you keep going back to it year after year?
Yeah, so the reason why I decided to do it is because in the office sometimes we do tend to see patients without insurance. So this was an opportunity for me to get out there, along with my other colleagues, to get out there to educate those people who do not have insurance. Sometimes just information itself can be worth $1 million itself. The reason why I keep coming back, because we see the benefit.
You certainly do see the benefit. The community sees the benefit of this as well. What do folks need to do if they want to get involved? Is it just show up? Do they make an appointment, put their name on the list?
Good question. We highly recommend that you go to our website, www.minorityhealthfair.org. If you go ahead and complete the pre-registration, that will help you ease the lines once you get there. But if you don't pre-register, come anyway. We'll have on-site registration. This is for the entire community, so it's not just for African Americans, and we want to stress that. So anybody who are uninsured, underinsured, or you may even have insurance, but you want to come out because it's really a big family reunion. We'll have entertainment. We'll give out lunches, but we want all your listeners just to come on August the 17th at Eastgate Town Center.
And I know a lot of doctors, when you have testing done, you have to wait weeks, if not longer, to get the results. In many cases, you'll be able to find out the results of the testing there on site. Chris Ramsey, Dr. Damian Brown, thanks to you both, and a job well done. Stick around. We have got much more coming up right after this.